Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach. And this is Dadvice TV Live, episode number 288. Wow, I cannot believe how long I've been doing this, and with my co-host who's here tonight, and how much helpful content we have created that will help you better take control of your diet, your health, and live the best life possible with kidney disease. Now, for those of you that are new, let me quickly introduce myself. My name is James. I am a kidney warrior. I learned the hard way the importance of diet and getting your blood pressure under control and following your healthcare team's advice. Now, my kidneys, there's no fixing them. But by living a healthier lifestyle, I have been able to reduce the burden that I place on my kidneys, so I'm not asking as much of them. And in return, my kidneys said, hey, James, we're going to help you feel better since you're being nicer to us. And my health has improved and no symptoms, thank goodness. Now, tonight, we're going to do a regular thing that we do every month. It's Ask the Renal Dietitian. And I have an excellent renal dietitian here. You all the regulars out there, you all know exactly who's coming up. She is from amazing website and Facebook group called PlantPoweredKidneys.com. There's a link to it down below in the description. You are definitely going to want to join that group if you don't belong already. So let me go ahead and bring on my co-host so that you can start typing in your questions, and we're going to try to get to as many of them as possible in the next half hour. All right, please give a great big giant Dadvice TV welcome to renal dietitian Jen Hernandez. Hey, Jen.
Hi, James. Hi, everybody. Happy October. Very excited to be back with you all and getting very much into this fall season that we have started. So, for those of you that may not know who I am, my name is Jen. I am a registered dietitian and I specialize in kidney nutrition. That's where I've spent the majority of my dietitian career, helping people with CKD. And that's what I do at Plant Powered Kidneys. We teach people how to enjoy more plants while taking care of their labs, keeping everything really in control, and understanding how they can enjoy more food in a new renal diet that's not restrictive like the old renal diet, which we might talk about a little bit more about that tonight, but really about enjoying more food that support your kidneys, support your health, help you feel better, help you have more energy, and just feel more knowledgeable about a renal diet that actually supports kidney health. So if you want to learn more about us, you can go to our website at plantpoweredkidneys.com, or like James mentioned, we do have a Facebook group. It is free, it is private, so other people in your Facebook world will not see your posts or comments in our group. It is kept private, but it's a very supportive community where people like to share foods, recipes. We do Q&As there as well, and we would love to continue to support and connect with you any way that we can from Plant Powered Kidneys. So without me just rambling on and on, let's get started with the Q&A.
All right, so everyone out there, this is live. It's Wednesday or Tuesday night, October 3rd. It's 7:04 Eastern time. The sun's starting to set here in Michigan, just outside Detroit. So that should let you guys know this is live. Type in the questions that you have. And I have one for you, Jen, to get things started. You have a class coming up for what I tell everyone was the worst symptom that I had to deal with kidney disease. And that was the complete lack of energy, anemia. And can you briefly tell us about the class that you have coming up? And there is a link to it in the description.
Yeah. So this is one of the things that we hear all the time from people talking about having low energy and not really understand what's going on. And while there are a lot of factors related to that, there's so many different aspects that can be connected to low energy. One of the things that people with kidney disease often have in common, especially in the mid to late stages, is anemia. And this is because the kidneys are supposed to be making red blood cells, but they can't do that as well in those later stages. And when we don't have enough red blood cells, they can't get the oxygen through our body, including to our kidneys. And there's kind of this vicious cycle where the kidney disease can cause the anemia, and then anemia can cause worsened kidney disease. And it can just be really, really hard. There are, though, nutrition changes that you can make, and we don't just jump right into supplements. Supplements can be a factor, it can be a part of it, but it's not the best method to just take a supplement without understanding what is going on, because they could cause more harm than good. So we talk about the different nutrition aspects when it comes to anemia. We talk about things to discuss with your doctor. We do cover different supplements and even the different types of supplements, because there are some that are better than others. We'll go over all of that in this class. The class or course itself is actually self-paced, so you can get in right now. You can enroll, you can start learning right away. Well, after our call tonight, you can start learning, and then you'll be able to join a live Q&A that I will be hosting there within the group for all of the students, talking about anemia, getting more of your questions answered, and really helping you feel much more assertive and knowledgeable about what's going on with your anemia, whether you have it or not. It's really, really important to be aware of and to be looking at, because as many of you know, you might not realize something is going on with your labs until it's kind of gone down the road. So I like to teach you things to look for so that you can have those discussions with your healthcare team.
Awesome. All right, we got the questions coming in. We're going to start with a great regular here, Dawn, and she asks, what plant-based foods can help you keep B12 good if you don't eat meat?
So one of my favorite B12 rich foods, which we've talked about, is nutritional yeast. This is a, yeah. So nutritional yeast is basically like a brewer's yeast that has been fortified with B12, and it is packed with good nutrition related to B12. So a little goes a long way, but it has kind of a like Parmesan cheesy flavor. And again, it gives you that B12 that you're looking for. So that's like my favorite B12 food to recommend, because it does fit into any diet. It does have potassium, it does have some organic phosphorus, but it is very manageable to be included in any type of renal diet as long as you like it. That's the ultimate point. As long as you like it, you're good to go. We actually did just post today on Facebook and Instagram about B12, covering foods, covering a little bit about supplements and why it's important. So you can definitely follow us on Facebook or Instagram as well to get more of these kinds of tips and information Monday through Friday, basically.
And I'll tell you, I love brewer's yeast. Once you got me aware of it or helped me become aware of it, I add it to stir fry, I add it to salads. It's easy to just sprinkle it, get a little bit in there, get some extra goodness in the food that I'm eating.
Yeah.
Now, Resi asked, is barley powder safe for CKD?
That's a really, really interesting question. And I will tell you, it's not something I'm very familiar with. I'm familiar with
Me
barley.
neither.
I can say barley is safe for CKD. Barley is a great whole grain option that has a lot of great nutrients for you. And even though it has phosphorus, it's not highly absorbed. So those with phosphorus concerns, barley would not be one of those things I would be looking at. But barley is a great grain that you can use in substitution of like oatmeal or rice or other types or like quinoa or something. It's just a fantastic grain to use, and it's really easy to make and very versatile. So barley in general, I would say, is okay. My question for the barley powder would be, and this is always something that if I don't hear about it, I'm curious, like, what have you heard? What have you seen? Who's been telling you that it's good? And is there research behind it? Or is it someone just saying, take this and you'll be fine? Because that's, kind of something that we want to be careful with. And then also, what would be the reason that you would take it? Why are you looking at taking it? Again, kind of going back to like, are there benefits to it or something? And if there is a certain reason that you're looking to take something like this, maybe there is another more proven method or better food option that is a little bit more ingrained in science. I'm not saying that you can't have it, or it's not beneficial. I'm just saying it's not something I've heard of. So I'll have to definitely be diving a little bit more into this to learn more and see if there is research behind it.
Yeah. All right. Here is a great one from Parker. So it sounds like Parker is taking or considering taking Renadil along with their diet. And they ask what time of day, with or without food, with or without fiber. I take it, so I'll give my answers and I'll let you chime in. I take it in the morning. I take 2 pills in the morning. I don't take it with food. I do not take it with fiber. If I was going to have fiber, I would just eat an apple in the morning. But I pretty much have gotten to where I don't eat breakfast anymore. As a matter of fact, today I didn't eat lunch until about 4:30 because we were shooting some videos at work, and I just got busy. And all of a sudden, the day was practically gone. And I'm like, whoa, I gotta go get me some lunch. But when you first start Renadil, it can cause gas. Your friends will know that something changed in your diet, so you might want to space it out. Take one in the morning, one in the afternoon, late afternoon. But that's my experience with it. I've been taking it for years now. Just got 3 new bottles in the fridge, so I get my 90-day supply. And anything you'd like to add to that, Jen?
Yeah, so you can take it with or without meals. I typically say take it with a meal to help with getting it through your system and getting it into your gut so that it can be used as a probiotic. So, what it's doing essentially is helping to nurture your gut, make sure that your gut is able to break down and digest the foods that you eat. So, one of the important things with any type of probiotic is taking it consistently. It's not something that you can take for 1 or 2 weeks and expect all of a sudden to see all these incredible results. You do really need to take it for like 3 months to see any type of results. And there are many people that do see results with their kidney labs that can be better. Renadil has done studies looking at this, particularly in dialysis patients, but other probiotics are also helpful as well. And sometimes I even recommend probiotic cycling, doing maybe Renadil for 3 to 6 months and then switching over to a different probiotic to just get different bacterial strains through and to help just kind of create more diversity in your gut. So that can be something that's really helpful after that 3 to 6 months of trying it to see what your labs look like, how you feel, because yes, you can have some digestion changes, which is good. It can mean that it's working because your gut is able to take care of things. But pay attention to what your gut is saying in the metaphorical and literal versions. And sometimes probiotics aren't going to be helpful for some people who have SIBO, the short intestine bacterial overgrowth. Having a probiotic could actually cause more, kind of discomfort with your gut. So again, make sure you talk with your healthcare provider, make sure it's something that's appropriate for you, and then always be monitoring, paying attention to what your body is telling you when you try something new like a probiotic.
All right, we got a complex question here from Debbie, who's in Oregon. She's CKD stage 3B. That's great, Debbie. Good. It's kind of on the earlier side, and I'm glad to see that you're here learning about diet and stuff like that to help slow the progression. She's asking, what can she make for lunch? She's looking for something low protein, low potassium, low carb, but high calorie. She's dealing with blood sugar control challenges.
Okay, so obviously, I don't know everything about your story, Debbie, and so there's going to be some caveats to this, but I want to try to give you some ideas and things to think about, because what I'm hearing is it's a lot of low, cut this out, be careful with this. And in some cases, that can be true. But for stage 3B, in
Mm-hmm.
these early stages where it's considered moderate or even mild kidney damage, there's not as many restrictions as we think. So doing something like low potassium, if you don't have the requirements of a low potassium restriction, which means basically if your labs aren't saying that you need to be careful with potassium, you might actually be making it harder for your body to take care of everything it needs to take care of, because potassium is a very important nutrient that most of us already don't get enough of. So I just want to challenge you on that. We do have an article at Plant Powered Kidneys about the low potassium diet, and potassium was one of the big modules that we teach in our Plant Powered Kidneys course. So those might be some things that you want to consider learning more about, because it's a passion of mine to challenge people's thoughts of what this renal diet used to be. And if you are searching online for a renal diet, you might actually be coming across a lot of information about a dialysis diet, which is a
Yes.
type of renal diet, but it's not for everybody. And they don't necessarily say dialysis diet, right? They just say a kidney diet or a renal diet. But a lot of those are actually meant for dialysis patients, or patients who have very, very little to no kidney function left. And that's where a lot of restrictions can come in place, because the kidneys aren't able to manage it. But with stage 3, there's actually a lot of great wiggle room that you have to include more nutrients to support your kidney health. So that's kind of one thing I would be talking with you about if we were working together, is to be looking at potassium as more of a resource than something to limit. The other thing is the low potassium. You put it in there twice, and I can tell it's a concern. It's something that you're focused on. But with blood sugar control, maybe diabetes, prediabetes, things like that, and kidney disease, the restriction of protein needs to be very, very mild, because the research shows that people with both CKD and diabetes or blood sugar issues might need to have a little bit more protein compared to the idea of a standard low protein diet. So I know that probably sounds confusing, like, wait a minute, we're throwing another wrench into this, but really that's part of what makes the renal diet kind of good and bad. It's good because there is more flexibility that we can look at. So I'm saying we don't need to necessarily be holding protein back too much. So there is some more wiggle room for you there. But yeah, blood sugars, taking care of that. That is another level to be looking at, controlling your glucose levels and your blood sugar so that it does protect your kidneys. That's really, really important. So for this side of the equation, 2 other articles that we have that dive into this. We have our renal diabetic diet article, and we have our low protein diet article. And I go into a lot more information of both of those things, and those would be things to consider. Now, to get through all of that, the other part, the final part that you were asking about, was actually being able to eat enough calories and to get, lunches that will be able to take care of these things. So getting enough calories with CKD can be a challenge, but one of my favorite things is to encourage more healthy fats. So I'm talking about using avocado oil, olive oil, hemp seeds, flaxseed, chia seeds, even avocados, nuts, and seeds. These nutrients can come in small amounts, but actually provide a lot of calories for that smaller amount. So you don't need to go way overboard. You don't need to add a ton, but doing just an extra drizzle of olive oil when you're cooking something, or when you're making a salad or whatever it is, even like on soup, doing a drizzle of an oil on a soup can provide like 120 more calories for a tablespoon. So something like that, adding more healthy fats can be really helpful. For lunches, I know a lot of time lunches are things like leftovers for dinner. So again, it's easy to add a sprinkle of pumpkin seeds or some walnuts or almonds or something on top of like maybe a leftover meal, or adding that dash of olive oil. Something like that can be really, really helpful. Otherwise, let's say you could do a peanut butter and jelly sandwich. And peanut butter is something that does have higher calories for the small amounts. Usually we go a little bit overboard with our peanut butter, right? When we really like it.
Me.
Yeah, same. It's great. So you can do some more peanut butter, and then the jelly also provides your calories, and then you have your bread. So a sandwich like that can be a 500 calorie meal when you use enough of these nutrients. And then providing other nutrients along the side, whatever you prefer is, that's totally up to you. But I think a sandwich like that is just super easy and can definitely fit.
I love to add chia seeds in my peanut butter and jelly sandwich.
Mm-hmm.
Because
Jam. I mean, just mashing berries, like mashing raspberries, adding chia to it, and let it sit, and then you make your own jam like that. It's so easy, and it provides so much nutrition.
very good. And I'm gonna ask a question, which I think would be helpful for Debbie. Jen, you mentioned going online, looking up kidney diets, and we find all
Mhm.
these ones that really are dialysis diets, but they don't say that.
Mhm.
Who or how do I know I should go on a low something diet? When do I need to start restricting? Who tells me that it's time? Or how do I
You're
find out?
leading me.
I know. You know what
Well,
I wanted you to say.
yeah, yeah. I mean, honestly, you are going to get the best information when you work one on one with a dietitian. I mean, imagine the ability for you and I to sit down for an hour and a half, and just go through your labs, talk about the foods you like, talk about the things you've tried, have worked, have not worked, look at your medical history. Like, we would dive into all of that, and then be able to decide what are the best foods for you. What are things that are going to nourish you, both in a hunger satisfaction, but also a comforting way, so that you're not feeling deprived with this idea of a renal diet that cuts out everything. We can go into everything when we work together one on one. And the next, or the second best option, and this is me being very biased, but our plant powered kidneys course, we've had great results. I was just looking through a lot of our weekly check-ins this earlier this evening, and we've had a lot of great success. And even somebody, I think, mentioned it in the
Right here,
beginning.
Deb.
Yeah, yeah, so we have had great results, and it is a fraction of the cost compared to working one on one with a dietitian. But you get the resources, you get all the classes. We talk about a lot of the stuff in our community, and then I do live Q&As to just add another level of support for you. So if that's something that you're interested in, I mean, I'm very much tooting my own horn, but honestly, I'm kind of tooting like Deb's horn and like everybody else who has taken the course and had, all these different levels of great results, just by better understanding, having the knowledge, gaining that confidence, and understanding what to look for yourself, for your own renal diet. That's really what matters at the end of the day, is just having a better understanding, so that you don't feel so in the dark and lost and confused, and just grabbing at every piece of information you find online.
All right, David asked, and oh, David, I feel for you. I'm in the same boat as you. I keep delaying getting mine done. But David asked, is it safe for a kidney patient to have a colonoscopy?
Um, this is a bit more on the medical side. I will say, from the kind of like the nutrition side, um, you can make some changes to your diet to prep for it. And there are some prep formulas that'll be, kidney friendly. And you can talk with your healthcare provider about which one that you'll be using, so that you can go through the procedure. I mean, I'm a really big fan of, to go through anything that's preventive, which colonoscopies are a preventive procedure for you to make sure that everything's okay. I think that's really, really great. So that's kind of as much as I could say on the topic. But if your doctor's talking with you about it, I think it's really, really important to just continue with that conversation with them, so that you do feel comfortable and confident with that game plan, and understand why you're going through this.
Yeah, it's time for my next one. I've just been putting it off because I remember the prep
Mhm.
period from the last one. But the
Yeah,
good
stay
news is,
home.
yeah, I asked my doctor, I said, hey, I want to make sure I don't get dehydrated, because that's a challenge when you're going through the prep process. And she told me, don't worry, just drink a lot
Mhm.
and you'll be fine. Things have changed. And she told me it tastes better. It's not as difficult as when I got my last one. So I'm not looking forward to it, but I'm hoping it's better. I'm gonna wait till like November. I've got time off from work. I want just get it done and not go back to work for a couple days.
Yeah, just stay home, just take
Yep,
care of yourself.
Netflix and chill.
Yes, exactly, exactly.
All right, here is one that I see from time to time. So this will be a great one to get out there. Weapons Man asks, is microwave popcorn good or bad for kidney disease?
Well, I mean, popcorn in general, I think is a great option. It's actually a whole grain and it has fiber. It has that whole grain, the nutrients there. So I think it's a really, really great option. And sure, there are some brands or some types of microwave popcorn that may not be the best choice because they might have additives in there, whether it's potassium or phosphate additives. They could be high in salt because when we think of popcorn, a lot of times the thing that they want to sell is that, very salty, fatty, all the buttery kind of goodness. So just keep in mind that with all of the options that you find at the grocery store, pick a few of them that are interesting to you that maybe seem like a good choice, or maybe the more affordable options can be really great. And then compare the nutrition labels to each other. Look for the ones that are the lowest in sodium and that don't have a lot of saturated fat in them. That's also really, really helpful for our health. So if you do that, you can definitely find a great option, but you can also microwave your own popcorn. Just get popcorn kernels, add a little bit of oil into like a paper bag, or I have like a silicone popcorn kernel container.
I've got one. I got it off of Amazon.
Yeah, yeah. I mean, something like that is really easy, and those popcorn kernels will last. You buy that big container from the grocery store, they don't add anything to it, and it lasts for quite a long time. So you can do something like that. It's very, very easy to do that too.
Yeah, and I have lots of different seasonings that I can add to add flavor. Um, Being here in Detroit, Canada is like 30 minutes, and we're across the border in Canada, and they have a lot of options of just plain popcorn. And we'll buy some of those so we can throw them in the microwave easily. No salt, anything. It's just pretty much popcorn in a bag
Yeah.
with a tad of oil. We'll pop that up, and we also get the flavors from over there. They're not ones that I found here in the States, because over there they're a lot tighter on the control of what's going into the foods. They're not as easy at putting in all these preservatives and all the artificial stuff. They don't like to load it all up. But I'll find what they are and I'll post them on Facebook. But they taste great, lots of variety. Now, they're not like butter or anything like that. These are like spicy popcorn,
Ooh,
lime and spice. Oh, good stuff. You're like, oh,
yeah,
this is delicious.
that sounds good.
All righty, let's see. Here's a question. We're getting close to the end of our time here. Marie, oh, I'm not going to try to pronounce her name because I don't want to butcher it, and I'm bad with names. She says, "Hello, which is better, whole wheat bread or white bread?"
I mean, better can be very subjective, right? So better for who, better for what. I'll give a quick kind of comparison of the two so you can decide which one is the best or better option for you. But well, okay, spoiler alert, they can both fit in a renal diet. How about that? They can both fit. There's again pros and cons to each of them. So I'll start with the white bread. White bread is tasty. I mean, it's such a classic for a reason. You can find low sodium options for white bread, so it can fit into a low sodium diet. You can find white bread that doesn't have potassium and phosphorus additives, which also makes it helpful. So it can be enjoyed in a diet. Pairing something like a nice, crusty white bread with some soup or with a stew, sometimes you just can't beat that. That's just a really, really great option. But that's one of the things that you want to be careful of is making sure that you do pair it with a meal. You have some fiber, you have some protein, you have some healthy fats, you have more to help the body kind of slow down the absorption of the carbohydrates that come from that white bread because they're a simple carb. And if you take just a piece of white bread, it will absorb quicker. So you won't be feeling very full because it just gets put into your body pretty quick. And it can spike blood sugars a little bit higher than something like a whole wheat bread. Whole wheat bread does include the whole wheat, the whole part of it. So it takes longer to break down, to digest and absorb. You can find low sodium options. You can find low potassium options. You can find low phosphorus, no phosphate additive options. Whole grain bread is great because it does have that fiber. So it inherently doesn't absorb as fast. So you can feel full longer. So if you had some toast or something, a whole wheat bread bread could be a better option to give you a bit more satiety. But it's still a great thing to add to something like soups and stews, to use for sandwiches, anything like that. So they both can fit. I think it's great to lean a little bit more towards the whole bread side to get enough fiber in your diet. But I'm not going to say you can't have any white bread or white bread products anymore. It's just something to fold into your diet. How can you include it? Look at the different components of your meal, of your diet, so that you can find ways to enjoy it.
Yeah, when I was first diagnosed, I was surprised that there's sodium in practically everything, and some breads were pretty high in sodium, and a serving is one slice.
Yeah.
I can't make a sandwich, at least one that I want to eat, with one slice. That's half a sandwich. So that I got really good at looking for that sodium and finding bread that's low in sodium.
Yeah, and they have plenty of options that are like 100 milligrams or so per slice, which can be really, really good compared to some of the ones, if you look at like some like the thick white bread or like the Texas toast kind of style, those can be like 200 milligrams plus per slice, which that can add up pretty quick. That's about 10% right there of just one slice of bread.
Yeah. Whew. All right, Jen. It is a little after 7:30. Our time is up for tonight. I want to thank everyone out there. Now, there are links in the description below to join the Plant Powered Kidneys Facebook group. Definitely, if you don't belong to that, go join it. Even if all you're going to do is sit back and look at all the great things people are making and taking pictures of and sharing the recipes of. There is so many ideas and creativity in there. That alone makes it well worth joining. Plus, like Jen said, it's private. So if you want to talk about something, you don't have to worry about, okay, this is something, maybe not everyone's as public as I am about having kidney disease. That is perfectly fine. You're okay there. It is a private group. People who do not belong are not going to see your post and the conversations that you're having. So I encourage you to take that. Plus, there were some questions about anemia. Jen has a great class coming right up, but you got to register by Thursday night, which is just, 2 days away?
Friday night. Yeah, Friday night.
Oh, Friday night.
Eastern.
Yep, just a few days to register. The link also is in the description. Please give the video a thumbs up. That helps us get recommended to more people out there looking for tips and advice with kidney disease. Jen will be back again next month. We're doing the same thing. If your question didn't get answered, so sorry. We're only able to get to so many of them. But next time, come in. As soon as we start, cut and paste your question. Boom, 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 boom. Pop them in there so they'll be right there at the top of the list and a better chance of getting answered. Thank you so much, Jen. Greatly, greatly, as always, appreciate it. And I'll talk to all of you next week on the 11th. I have Dr. Rosansky here. We're going to talk about blood pressure medications, which ones are the safest and best for kidney patients. All right, everybody. Until then, have a wonderful, wonderful week. And I'll see you October 11th. Bye, everyone.